like you were talking about passion and treating patients. There's a downside to that as well, right? You see people dying. You
Exactly.
have to. How do you deal with that trauma? Does it give you trauma?
See, we are doctors, not gods. After going so many years, like MBBS, postgraduate, and so on, you know what. At first instance, you can come. Okay, especially if you take my subject, orthopedics and spine. If you see a patient, if you spend at least 10-15 minutes, maybe it's a trauma or some condition, a cancer of spine or a degenerative disease, you know whether it's treatable. We need some time and multiple surgeries, non-treatable. It's like where the spectrum, it's like a spectrum of treatment,
Okay.
where the patient lies. We are not gods. It's like you cannot treat or make everyone back to normal. We can change their life, we can make their life better.
Okay.
Even if you can't make some diseases, you cannot do anything because the risk benefit ratio, where risk is more than benefit, we cannot do anything. At least we would be able to explain the patient okay. But it's all about the person, we say. If you see a 10 patient, at least it's not mandated that you should make 10 to 10 patients fit and fine and happy. At least if you are changing 6 to 7 patients' life, that we think it's making a difference in someone's life.
I'm pretty sure there must be stories where you thought you could save a patient, but it didn't turn out to be that way.
Yeah, so it's that many things, especially when I remember, I'll tell you one story. A 10-year-old boy who had a brainstem compression. He was he had other challenges also. We did some 7-hour surgery. We at the brainstem we operated and we released everything. It was very adrenaline rush was going on because we were dealing at the most vital structure of the brain. At the end, when we saw intraoperatively, the result was, we will make this child walk in future. But with other reasons, child could not survive.
Okay.
Because, his lungs were not cooperating because he already was suffering from that thing a long back. So it was. So we were not we could give them the best. But the thing is that it's you put a seed in the soil and you put water, you put fertilizers and everything. But it's not that mandated that you get the tree, a plant or tree and you can eat that fruit. But okay, at least attempting is important. Many of the times happens we have done a very bad multiple fractures patient, they come with a road traffic accidents and this all. I'll tell you just 2 days before experience. A guy traveling in a car, his other colleagues died on the spot. He had neck fracture, he had thigh bone fracture, he had multiple lung, chest injuries, nose injury and this all. First one day we just told, we can't say for next 24 hours, even if it a cheek may day. But after 24 hours, the patient started throwing response because maybe of his willpower, good body or good genetics. Then in one session, in 8 hours, we did his 3 surgeries. Even after that, patient survived and he is stable now.
Okay.
In the morning, we saw the patient is fine, talking, and we were it's like we treat, he heals. It's like you just do your job, but you cannot assure. Okay. And that tricky situation, if patients and their attendants are able to understand, then it's a good thing for us. Otherwise, we'll be always judged through their lenses.
True.